I'm Martin Winkler. I'm a vascular surgeon. I work in Omaha, Nebraska. My practice is divided between clinical vascular surgery and wound care. Today is September 13th, and I'm at the Society of Advanced Wound Care in front of the Devon Medical Products exhibit in Baltimore, Maryland. Early 90s, wound care, negative pressure wound care therapy was rapidly adopted by all the wound centers around the United States. It was kind of like penicillin in World War II. Beginning in World War II, you had sulfa drugs and they worked, but when penicillin came along, it dramatically improved results of treating infections, especially for soldiers injured during World War II. Well, the results of negative wound pressure therapy were like penicillin. We know that most wounds heal as a result of bone marrow-derived epithelial cell precursors. What negative wound therapy does is sets up the ideal milieu for the survival of daughter cells from the epithelial precursors. You can't do negative wound pressure without a seal, and what I like about the Devon system is they give you a little gel ribbon that allows you to keep a tight seal in difficult places like the heel or open toe amputation. So you can rig a tight seal with their hydrogel in tough places like removing the second toe or removing the fifth toe. In Omaha, we've been using ExtraCare. I have a little experience with it. It's robust. You put the dressing on, the patients go home, and it usually lasts you don't hear from them again for 3 to 5 days. It's particularly good for the patients I see as a vascular surgeon with diabetic ulcers, ischemic, like amputation of 1 or 2 toes due to an embolic event. It's quiet. The battery works well, but particularly you can plug it in and fire it up so the patients can recharge the battery while they're using the device, and then when they need to go to the grocery store or the dentist, they just unplug it and off they go. I've been especially impressed at how easy the families figure out how to open and close it and how to program it. The dressings are intuitive. You can put on a dressing, and we usually put them on in the wound center, and then if the patients express an interest, we send home a dressing, and if it falls off, they can change it at home. And I've had good luck with that. So what I'm interested in is what gets the patients healed. Patient compliance is high with this. The patients like it. It's almost, for many of them, a red badge of courage. They can go to church, do all their activities. I don't have anyone who plays golf, but I assume at some point I'll have a golfer take an ExtraCare home. Thank you very much. It's been fun talking to you.